Imagine a support group made up of other pregnant women that know exactly what you're experiencing during these 9 months. How great would it be to have a chance to make lifelong friendships with a group of women who will have babies the same age as yours? Think of the fun you will have watching your children grow up together. That's the idea behind our prenatal care centering pregnancy program. It's a 10-session program run by a nurse midwife that groups together 8 to 12 women who are expecting their babies around the same time. The women in this pregnancy group become part of your support team throughout your pregnancy. You will learn together as you grow closer to your delivery dates.
It's an ongoing group prenatal care, which is really very different than the prenatal care that women get in the traditional setting in the clinic. It's all self-generated too, so the patients come in, they take their own blood pressure, they weigh themselves, they mark their own charts. They're sort of really in tune with exactly what's going on with their own pregnancy and their own health.
I find that it's very helpful. So I love it. It's not a routine. You sign in, you have a seat, you wait until you get called. You know, you get vital, you get sent back outside. You wait until you get called again for a room. Here, everyone comes in at the same time. They vital themselves at the same time. We start at the same time. We all leave at the same time. It's like a family-oriented. Like, it's not the basic clinic provider, nurse. I mean, they get the same nurse, the same provider each visit. They love it.
Generally, the more sterile experience of the clinic, you're not getting that community that we really want at Eisner. We really want people to be sort of use this place as their resource, and I think centering pregnancy fully embodies that. There's an intimacy that really helps create a sensitivity around women, a sensitivity around pregnancy that isn't sort of standard. We have a really good sort of dynamic where someone has a question, some of the other women there, wise women, have been able to help answer that question. So they're not only getting their prenatal visits, they're getting the education piece too.
The beauty of centering pregnancy is that clients are together, they are in a group, but the importance is that they all connect, they all learn together, they support each other, and they get amazing amount of time and information from their health provider.
It's a little private time for them to be able to sort of discuss details and things that might be going on. But we just measure their bellies, we listen to the baby's heart. We talk about, like individual kind of things of their labs.
You don't feel like you don't have any support. You have support. You can just call and, get appointments. And like here, they give you prenatal clips of any kind. So you get all the information you need.
It's the way the care is given. It gives the empowering to women participating actively in their prenatal care. So it really doesn't matter, what's your language. You're pregnant and you have to learn about pregnancy.
It's very special. Very special. And you feel important and you feel part of it. So that's what makes it very special.
I hope that people can see how wonderful this is from the perspective of their good prenatal care and the education that they get, because that for me is the thing that's going to transcend this pregnancy and the next.